Mr. Speaker, I move that the House suspend the rules and pass the bill H.R. 1528 as amended.
The clerk will report the title of the bill.
Union Calendar Number 338, H.R. 1528, a bill to amend the Controlled Substances Act to allow a veterinarian to transport and dispense controlled substances in the usual course of veterinary practice outside of the registered location.
Pursuant to the rule, the gentleman from Pennsylvania, Mr. Pitts, and the gentleman from Texas, Mr. Green, each will control 20 minutes. The chair recognizes the gentleman from Pennsylvania.
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill, and I would like to include an exchange of letters between the Committee on Energy and Commerce and the Committee on the Judiciary.
Without objection, so ordered.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized.
Mr. Speaker, I rise today in support of H.R. 1528, the Veterinary Medicine Mobility Act of 2014, introduced by Representative Kurt Schrader of Oregon. This is a common sense bill that is supported on the veterinary community, by the veterinary community, and will bring clarity to the sometimes conflicting guidance from the Drug Enforcement Administration, the DEA, relative to the Controlled Substances Act and the ability of a licensed veterinarian to transport and dispense controlled substances in the usual course of veterinary practice outside of the registered location. Simply put, the bill allows veterinarians to legally carry and dispense controlled substances in the field. This bill has a direct impact on my district, home of the University of Pennsylvania's School of Veterinary Medicine, New Bolton Center. Vets are often required to provide ambulatory services in the field, especially in rural areas, and for the care of large animals such as cows or horses. Sometimes it is not feasible for owners to bring the animals to a hospital or a clinic like New Bolton Center, and so vets provide essential house call visits. Clarification of the law is necessary to allow vets to transport and administer and dispense controlled substances outside of their registered location, whether to provide pain management, anesthesia, or euthanasia. Passage of this important legislation will allow veterinarians to complete ability to provide care to their animal patients beyond their clinics. This will protect the health and welfare of the nation's animals, ensure public safety, and safeguard the nation's food supply. A companion bill passed the Senate by unanimous consent on January 8th of 2014. H.R. 1528 includes 185 co-sponsors and is supported by the American Veterinary Medical Association, the ASPCA, the American Animal Hospital Association, the American Association of Equine Practitioners, and a veterinary coalition coordinated by the AVMA of over 110 organizations. I urge all of my colleagues to support this important bipartisan legislation. Reserve the balance of my time.
The gentleman reserves his time. The gentleman from Texas is recognized.
Mr. Speaker, I yield myself as much time as I may consume.
The gentleman is recognized.
Mr. Speaker, I rise in support of H.R. 1528, the Veterinary Medicine Mobility Act. This bipartisan legislation will prevent veterinarians to treat animals in the most appropriate setting. This is particularly important for veterinarians when responding to emergencies, treating livestock and wildlife, or working in rural areas. H.R. 1528 amends the Controlled Substances Act to allow veterinarians to legally carry and administer controlled substances in states in which they are licensed so they can provide care at the location of the animal patient. The Senate unanimously approved a companion bill, and I'm pleased the House is voting on this important legislation. Veterinarians must be able to legally provide complete veterinary care in a way that best protects animal welfare and public safety. I'd like to thank the sponsors, both Representative Kurt Schrader and Ted Yoho. I'd also like to acknowledge the leadership of Chairman Upton, Chairman Pitts, Ranking Member Waxman, Ranking Member Pallone, and the work of the committee staff in advancing this bill through the Energy and Commerce Committee and bringing it to the floor today. I urge my colleagues to join me in supporting H.R. 1528, and I reserve the balance of my time.
The gentleman reserves his time. The gentleman from Pennsylvania is recognized.
Mr. Speaker, I yield 2 minutes to the gentleman from Florida, Mr. Yoho, who is a veterinarian himself.
The gentleman from Florida is recognized for 2 minutes.
Mr. Speaker, I rise today in full support of H.R. 1528, the Veterinary Medicine Mobility Act, and I want to thank my colleagues, Chairman Upton, Chairman Goodlatte, Mr. Pitts, for helping bring this important measure to the floor, and a special thank you to my friend and fellow vet, Kurt Schrader, from the state of Oregon, who laid the initial groundwork. I also want to thank the Senate for unanimously passing this important piece of legislation out of that chamber. I've spent over 30 years in the veterinary profession, and the passage of this bill will allow for the continued use of drugs necessary to perform the work we do for our four-legged patients. The animals I've helped on ranches and in the field have no voice of their own, and they require a certain degree of service that only veterinarians can provide. Vets must have the ability to treat animals on site and in the field. Limit that ability, and you hurt a profession, you cripple ranchers across the country, and most of all, you unfairly restrict life-saving treatments for the animals, the patient who need them the most. Imagine what it would be if the cattle ranchers were required to bring their cattle in, or the horse owners to bring their horse to the vet every time they needed services. It directly affects their patient and their livelihood. My friends, take it from me. I practice veterinary medicine in the field, and if anything we need, more vets in the field, not less. This bill simply allows those in our profession to continue to do the life-saving work that we are trained to do on the animals that so badly require it. Join me in voting for this common sense measure. Thank you, Mr. Speaker, and I yield back the balance of my time.
The gentleman yields back. The gentleman from Texas is recognized.
Mr. Speaker, I yield to my colleague from Oregon, Congressman Schrader, as much time as he may consume.
The gentleman from Oregon is recognized.
Thank you, Mr. Speaker. I appreciate it. This really was a truly bipartisan, bicameral effort, including, as you already heard, an impressive coalition ranging from Farm Bureau to the ASPCA and 50 state veterinary medical associations. It's nice. I think the public should be reminded that while we have great differences in this body on many issues, there are also a lot of issues we agree on. I think this first 6 months has been a very productive session for this Congress, and this particular bill, I think, is noteworthy. It's a little bit of a shame we're actually here in the early stages of Drug Enforcement Agency's efforts to control the distribution and abuse of controlled substances. They issued a very blanket type of rule that unfortunately scooped up veterinary medicine and animals that we've been able to avoid this issue for many, many years. It's one of those where for last 100, 150 years, veterinarians have gone out to the farm and ranches. Nowadays, even within the cities, going home to home with mobile veterinary clinics, making sure those patients got the care with the appropriate medication that they deserve to be treated humanely. DEA in its exuberance unfortunately was unwilling to grant a waiver, a common sense waiver administratively, and forced Congressman Yoho and myself to go to a statutory change. Lots of taxpayer money, lots of time by the committees, but it unfortunately is necessary. And the good news is, I think, for America is that common sense does prevail a lot of times in this great Congress. As alluded to, we have over 185 co-sponsors of this legislation. The Veterinary DEA Mobility Act, allowing veterinarians simply to do what they've done before, which is carry controlled substances safely to treat, dispense, to protect their patients in the field. I think America would wonder why we're here. I think America is glad we are here, making sure that their pets, their livestock get the care and treatment they need so they can have safe food and fiber and take care of the pets that they love and live with on a daily basis. I'm not going to go into the bill itself. I think Mr. Pitts did an excellent job of outlining things, as did Mr. Green. I want to make sure I recognize a few folks that have been critical in the role here in getting this to the floor. First and foremost, my good friend and colleague, Ted Yoho from Florida, and his right-hand man, Larry Calhoun, did a yeoman's job making sure this is a good bipartisan effort. Chairman Goodlatte and his staff for their unwavering support throughout the process. Chairman Lucas and Ranking Member Peterson were invaluable. Matter of fact, I think we had all but 4 of the members of the Agriculture Committee sign on. Republican, Democrat, city, rural. This is a great bill. Senators Moran and King for their efforts on the Senate side. Chairman Upton, Ranking Member Waxman on Energy and Commerce Committee, and finally, extend my personal gratitude, very special thank you to Dr. Ashley Morgan at the American Veterinary Medical Association. Her tireless efforts through several years' worth of time to make sure that this bill actually got to the floor and got the vote that our animal friends actually deserve. And frankly, on behalf of all veterinarians in this great country, and I yield back my time. Thank you very, very much.
The gentleman yields back. The gentleman from Pennsylvania is recognized.
I'm prepared to close.
The gentleman from Texas is recognized.
Mr. Speaker, we have no other speakers, and we're prepared to close.
The gentleman from Pennsylvania is recognized.
Yield back.
I just
Gentleman
urge
from Texas
adoption.
is
I just
recognized.
urge passage of the bill, Mr. Speaker, and I yield back.
The gentleman from Pennsylvania is recognized.
Mr. Speaker, I'm pleased to ask all of the members to support this common sense bill that is on behalf of the life and safety of our animal patients and the safety of our food supply. I urge bipartisan support and yield back the balance of my time.
The gentleman yields back the balance of his time. The question is, will the House suspend the rules and pass the bill H.R. 1528 as amended? Those in favor say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended, the bill is passed, and without objection, the motion to reconsider is laid